Hello, everybody. Thank you so much for being here. Going to give it a couple minutes to let everybody join. Thank you so much for being here tonight. Just going to give it a couple of minutes to let everybody else join us. It's looking like we're having some technical difficulties with our Facebook stream, so I'm going to see if I can edit that, because that is where some people may be joining us. Just give me a moment. All right, since there's nobody here with us quite yet, it looks like our Facebook is having some problems, so I'm going to try and see if I can get that resolved. Thanks for your patience while we figure this out.
Of course.
No worries. Yeah, because I'm checking in Facebook and I don't see anything.
Yeah, it's saying that it's streaming to, hello, if you're on YouTube, I don't see anyone logged in, but it's telling me up in the top right that we're having some problems with Facebook.
So I can see YouTube. We're there.
Yeah, let me...
Carmen, you're able to log on from the Facebook end?
Not from Facebook, but from YouTube.
Okay.
Yeah, in Facebook, I didn't see anything.
Okay. Hi, if you're joining us on YouTube, thank you so much for being here. It's probably one of us. I'm just deleting Facebook as a stream and then re-adding it. And hopefully this will fix our problems. Okay, great. It looks like we're now live on Facebook as well. Perfect. Thank you so much for your patience. If you're just joining us, I'm going to give it a couple of minutes to let folks join the call.
Interesting, because I don't see it in in Facebook, but you do. So, oh, I see it now. Never mind.
Yep, it looks like we have someone who. Okay, was that you who joined? Okay.
That's me.
All right, it looks like we have people joining our call. Perfect. Hi, everybody. Thank you so much. We're going to get started in just a couple of minutes. Thank you for joining us. We had some technical difficulties with Facebook, so we're going to give 2 more minutes to allow folks to join this evening. All right. Looks like we have a thumbs up. Thank you for your patience. We're going to get started in about 2 minutes. Thank you for being here. Thank you so much for tuning in this evening. I'm going to give it one more minute and we'll start at 6:06. All right. Perfect. We're going to go ahead and get started. Thank you all so much for being here. Tonight, we are talking with Kennedy Krieger about mental health in communities of all colors. My name is Emily Levine. I'm the manager of adult services for programs and outreach at the Enoch Pratt Free Library, and this program is being held in partnership with the Kennedy Krieger Institute. We have two guest speakers this evening. Carmen Lopez Arvizu is a doctor who treats child and adolescent who is a child and adolescent psychiatrist at Kennedy Krieger Institute. She currently serves as the medical director of the psychiatric mental health program and as an assistant professor of psychiatry and behavioral sciences at the Johns Hopkins School of Medicine. As a clinician, her goal is to promote advocacy and improve services to families coping with duly diagnosed children, adolescents, or adults with education to the public, including schools, parents, as well as other medical professionals. We also are welcoming tonight Darius Sanders. He's a psychiatric clinical social worker with a passion for person-centered care. He holds a bachelor in social work from McDaniel College and a master's in social work from New York University. He has 7 years experience and specializes in treating neurodiverse populations and providing affirming care to children, adolescents, and families within Kennedy Krieger's psychiatric mental health program. Well, welcome to both of you. Thank you so much, and I will turn it over to you.
Thank you very much for having us. I think the most important thing that I'm going to tell you today thank you for coming, and that this is not a lecture. This is literally sharing with you some facts, giving you some ideas on how to address mental health difficulties, and then kind of opening the floor for conversation and question. So when we say conversation, that's really what we want to do. Now, this gathering is called Mental Health in Communities of All Colors. And we call it that way because I think there's certain lack of inclusivity and kind of, it's if you're one thing or the other, and it's about all of us and how do we fit in together. Mental health difficulties and do not differentiate any colors. So it is very important that we address this as one. So let me start with some facts for you. I wanted to give you some numbers so you can have an idea of why does this matter, and not just to me in a personal level or to us in a personal level, but in the big scheme of things in a global economy and in the global population. So we know that 1 in 5 US adults experience mental illness each year. 1 in 20 experience serious mental illness. Now, 1 in 6 youth ages 6 to 17 experience a mental health disorder each year. So that tells us that a lot of the kids that are identified will go on to develop a mental illness as adults. So we know that 50% of all lifetime mental illness begins before age 14 and 75% by age 24. Now, Darius and I work together and we see, mostly a pediatric population. I think, all the way to 18 or to 21 in certain cases of transitional age. So I think it is so important to be able to identify any difficulty in children so we can have early intervention and hopefully change the outcome of these numbers. Now, and I'm going to show you these numbers as well, because it's, why does it matter, or why should it matter to other people, to people that do make the policies, to people that decide how to spend the money and how to invest, the money from the government. Now, mental illness and substance abuse disorders are involved in 1 of 8 emergency department visits in the US. So this is actually even before COVID. After COVID, it probably has increased, but this is before COVID. Mood disorders is the most common cause of hospitalization of all people in the US under 45. Can you believe that? That is just such an amount of people being hospitalized or visiting the emergency rooms because of mood disorders. And this is, of course, excluding hospitalizations related to pregnancy and birth. Now, about expenditure across the US economy, serious mental illness, has an expense of $193.2 billion of lost earnings each year because of mental illness. 20% of people experience homelessness related to serious mental health condition. 34% adults incarcerated in the state and federal prison system have a diagnosed mental illness. 70%, that is just so overwhelming, of youth in the juvenile justice system has a diagnosis of mental illness. 41% of the Veterans Health Administration patients have a diagnosed mental illness or substance abuse disorder. Now, mental illness and substance abuse is directly connected with money because it's expensive when not addressed. And what we don't invest in prevention of the long-term effects, and by we, I mean, the budgets will pay triple. Now, why does it matter and why do we care and why am I talking in numbers and in money? Because suffering is not measurable for those who do not feel it. So this is the only way that we can make an impact, by showing the people that invest in treatments, invest in new research, is by how it is affected by numbers. But that phrase that I just said is just something that I really truly believe. Suffering is not measurable for those who do not feel it. So it is so important to continue to emphasize that. Now, suicide, it's something that, we just had this month about suicide awareness. And so many people are afraid of even saying the word. There's so many cultures, you can hear my accent. I have a Hispanic, a Spanish accent. And I come from a Hispanic culture in which the word suicide is something that you don't say out loud. However, it is significantly undervalued as a public health problem. And it's the 10th cause of death across a lifespan. However, for youth, it's significantly more relevant. It disproportionately affects this population. We have seen, and we saw this significantly before COVID, but during COVID as well. So it has been there, but it has been more noticeable after that, is that the suicide rates have increased over the past decade, and specifically among minorities, particularly in the Black and Hispanic population. So that's something that we need to talk more about and make sure that we are aware as clinicians like Darius and I, but that you are aware just as being part of an extended group of family, friends, or people that are around you, because it's there. Just because we don't say the word, that means it's not present. Oops, sorry. Let me see. I think I skipped that. Yeah. So again, we work with a lot of pediatric population, and mental health disorders are highly prevalent. Like I said before, 20% of the pediatric population, and it causes significant individual and family suffering. It does not affect only the person that has the difficulties, but everybody that surrounds them at home, at school, with peers. And you will often see how it affects actually their surroundings more than even the individuals sharing their difficulties with you. You will probably start noticing things around behavior and performance. We know that mental health also affects and predicts physical and mental impairment in the adulthood. So we know that it increases the risk of any health problems and unsuccess in life. It increases also the risk of trauma, substance abuse, and unemployment, arrest, disability, and overall lack of the ability to function in society. And just like I said before, 50% of the serious mental health disorders will onset by age 14 years old. So it is so important to identify and address it. Now, this part here is that, why is it relevant to me, to you, to us in the communities of color? We are individuals of color, but we also serve a lot of individuals of color. And it is a very noticeable in the last few years, documentation of the population about the increase in Hispanic population and Black population. So according to the US Census, by 2044, more than half of the Americans are projected to belong to a minority group, of any color. That's why all colors are relevant for this conversation. I'm sorry, let me see here. And I speak super fast, so I apologize if I'm going too fast, but there will be time for questions or clarification if you need any. Now, one of the other things that it's interesting of how the census captures us, it has changed through the ages. I like this timeline a lot because it is very different on when you get a census questions and they ask you, what are you, right? So to me, it's very difficult because I'm just not used to it. They always ask you race, and then they ask you ethnicity. And I don't know what race I am because they don't have like this one. It's white, Black, whatever, but they don't have mine. I don't know what I am. I know I'm Hispanic in the ethnicity side, but I don't know what race I am. So I'm sure there's so many of us that will get lost in that shuffle and are not captured by the census data. Okay, so why does it matter? And it matters, all these numbers in the census and all these numbers on the visits and all these numbers on the diagnosis and all the data is because these kind of numbers show where do we need to have an effect. So we know this year, you saw it, everybody saw this in the news, that the US Surgeon General had an advisory in youth mental health and declared a national crisis in pediatric mental health, supported by all these professional organizations. Now, let me tell you something. As somebody that is a clinician, what I think is a frontline mental health clinician with feet on the ground, this is not new to me. We've been in a crisis for mental health for years. People are just noticing now because, they had to see the data, but we see it. And we see the difficulty on accessing care, and we see the difficulty of accessing not only crisis and acute care, but also all the middle ground there of intermediate care. There is a shortage of beds for hospitalizations. There are not enough crisis services. And the reality is that the stigma is still present significantly enough to interfere in our ability, willingness, or even awareness of approach, mental health treatment. Now, on the middle of all of this, we had COVID, which, kind of just threw a mess into an already difficult landscape. So we know that stress epidemics can cause stress. Definitely. We have seen it through the years. It's like COVID was a repeat, a little, of course, more intense and more widely disseminated. But we saw this. In the 80s, we had HIV, and then we had Ebola, and then we had H1N1. So a crisis of health, people panicking, affecting everybody. Then on top of that, you add the socio-political environment, which has been pretty difficult for us people of color in the last few years. Pretty significant. And then we have wars all over the place that can also affect us here. All of these things cause emotions from fear to panic to anger. And we see this. I mean, if you watch the news, which I try to avoid, you see all of these things. And all of this watching of what's happening in the world increases our own anxiety on this. So we have the prolonged stress of the things like we have, like COVID and all the other things that I've mentioned. Then with COVID, we saw a lot of real losses. We lost relationships. We lost family members. We lost financial income. We had a loss of positive experiences because all of the things that people usually expect, how many weddings were canceled, how many graduations didn't happen, how many dances, how many games, how all of those things that we expect as human beings, or we're just so used to having things as part of our daily life. All of that was put on hold in the middle of an uncertain health, financial, and political crisis. It was a significant amount of stress on all of us, but particularly if you are at risk of having any kind of mental illness. Now, the loss turns into grief, and prolonged grief can turn into depression. And that's when things get much more difficult. We have the uncertainty, the anxiety, the loss of hope, and the reality of bad things happening around us. There's no way of hiding that part. Sometimes bad things happen, and it is very real. And as humans, we respond to our environment. And we learn from adults that surround us. And many times, children particularly get very stressed and anxious and kind of get into this contagion of the loss of hope and fear, because that, good things are more difficult to expand and share, but bad things spread like a fire. Positivity is much more slower. Now, in the last few years, like I mentioned, we had the social distancing, we had the changes in the daily routine, and we had other bad things happening, reduced income, increased responsibilities. And we saw that particularly in both sides. We saw the kids having a lot of difficulty because of the loss of the social interaction, but also of the observing and kind of feeling that the stress from the parents, because a lot of parents had to be workers, had to be parents, and had to be teachers all at the same time. We are one human being. You can be 100% one thing. You cannot be 300%. You cannot be 100% working, parenting, and teacher. Something's going to fall. And when you try to do all of this at the same time, the level of stress will just increase. We saw that low-income families were disproportionately affected by this situation. We saw that children with behavioral and emotional problems deteriorated during this time, children with medical complications, and definitely parental psychopathology affected both children and parent as well. Now, what can we do in this uncertain world? And I'm going to pass it on to you, Darius.
All right, awesome. Thank you so much, Carmen. So Carmen did an amazing job giving us sort of some of the background, some of the history, things that we've been noticing, and just more important statistics related to mental health. And when we start to think about the term mental health, this topic, preventing, recovering from it, you might hear this term of resilience being thrown around. So we're going to talk a little bit about this topic of resilience, how we can build it, and then we're going to finish off with a little bit of some resources that could be helpful when we think about people in communities of color accessing resources for mental health care and just reaching out to help build some of that resilience in themselves. So next slide, please. So we'll start with a definition of resilience. Like I mentioned, we've probably heard this word before, and it's come up in many different conversations with many different definitions. So for the sake of today's presentation, we're going to be looking at resilience as our ability to bounce back from a negative experience or adversity. When I think about resilience, I like to talk about it not being something that's built overnight or that's sort of built in a day or from one experience. It's a skill that is ongoing that we build throughout our lives, where we accumulate experiences, we accumulate positive coping strategies, and we find ways to really push through some of the adversity that this life brings us. And one of the reasons why resilience is such a big topic is because life, one of the things that are going to be pretty much guaranteed to us is adversity, negative experiences, and pain. It is a part of life. So developing resilience really helps us figure out ways to tolerate the stress in life without making things worse, and being able to just sort of bounce back and help ourselves through some of life's challenges. And so here we talk a little bit about resilience being the process and outcome of being adaptive in our environment and to some of our challenges and life experiences. There are so many different factors that go into how individuals can build resilience and how they will in their process. But just looking at it over time, this is something that builds on top of all of the skills and experiences that you've had throughout your life thus far. Next slide, please. So here we look at a diagram just of how resilience sometimes comes about. Is that we will have a negative event that brings us the stress, the pain, the challenges. And then from there, when that event or those challenges subside, we find a sense of recovery. And from recovery, we kind of learn and we adapt to some of the challenges that life will throw our ways. We'll either learn skills or we'll start to implement some of the things that I'll talk about later in our presentation today when it comes to building resilience. And from there, after having that negative experience, some of those difficult emotions and really find to build yourself back up, the hope is that as you move forward, the next event won't be as challenging or you won't have as much of trouble bouncing back from that moment of adversity or difficulty. And that slide there just talked a little bit more in detail about that process. And so thinking about resilience, the different factors and the reason and variables and why people might develop them at a quicker rate or might find ways to develop them that others don't. We think about who the person is individually, their biological makeup, right? These things that we can't really change about ourselves. We think about like our temperament. And sometimes if there's cognitive limitations that are there as well. We think about our individual relationships, the quality of them. Are the people that we surround ourselves with promoting resilience, modeling resilience in themselves? And having a core like support group is one of the ways that we find that resilience is built, because it really teaches us to lean on our support network, which then pushes us through that adversity. And we think about our environment as well. Our schools, our supportive communities for those who are involved in other activities. We think about faith-based activities as well. So when we talk about promoting resilience, it is very important that we try to promote it in ourselves. We try to build it within and for others. And one of the first steps is to figure out what can we actually control, focusing on some of those things. And it may be getting involved, building that social network, seeking services. And on that slide, and I'm wondering if these links will be accessible after the presentation, but this link at the bottom, Roadmap to Resilience. It's just a set of tools to help build some of those strategies and some of those levels of resilience that we spoke about earlier today. One of my favorites when it comes to promoting resilience is working on building our connections, prioritizing our relationships, because relationships in both the short term and long term are some of the things that makes life worth living. And that's where we get a lot of our major support. We get some of the validation from others that really help us see what we're going through is difficult and we're able to move through it. And we think about relationships with our communities, our family members, but also relationships with people who are developing new relationships with people we have not met just yet. And one of the ways that we like to do that is we think about joining a group. There's so many ways to join these social groups. I know here in Baltimore, rather if it's something centered around an interest. Focusing on building up your relationships and your support network can be one of the ways to really promote resilience. And Carmen touched a little bit on some of the wellness, right? We think about how the ways that we take care of ourselves. As humans, we become more vulnerable to stress and either overreacting or underreacting based on some of the things that we've experienced in our life, based on some of the pieces that we're facing in the moment, some of the things that we're maybe lacking, or some of the things that we don't really bring attention to. And sometimes that can even be our body, self care, our mind, right? We think about those of us who might have medical challenges that we're maybe not addressing. Working on some of the very baseline things of how do I keep myself feeling well from a medical standpoint so that I'm feeling strong enough that my mind can kind of start to work on its own and in tandem with my body. One of the ways that we can really foster our mental wellness is by practicing mindfulness. It's one of my favorite practices. It really helps you be more aware of what you're thinking and what you're feeling in the moment, so that way you can express what you're thinking and what you're feeling. Some of the more common practices, you'll hear about meditation, guided meditation, yoga, prayer, and journaling. I also think that mindfulness can be as simple as us removing ourselves from our screens and some of our day-to-day activities. I think about even when I'm washing dishes, I try my best to put all the distractions to the side and make that moment just about what's happening right there in the moment. And again, mindfulness is also a skill that takes some time to really, for you to really notice how much of a superpower it can be. Avoiding negative outlets. Carmen touched on news. We think about what we take in through, again, our screens, social media, and sometimes even the people that are around us. Negative energy can definitely be contagious. Finding a purpose. As someone who has moved into a helping field and has known that this is what I wanted to do for most of my life, I find that I'm at my best when I'm at the service of others. So for you, it might be finding a different purpose, finding something that really helps you feel needed in society, helps you feel that you have a contribution as well. And some of those things could be, helping others. Also, moving towards your goals can be a sense of purpose. Rather, that is a goal of learning a skill, a goal of being able to, go to college, being able to learn a trade, learn something that you might have been wanting to learn for a little while now. It's really kind of getting in touch with yourself here when it comes to purpose. We can go next slide, please. Oh, no.
The next one, oh, there you go.
So I wonder if I froze. Am I frozen on you guys' end? I apologize.
No, I have up the one that says promote resilience.
Yes, find purpose. We can go to next slide. Sorry, I'm frozen on my screen, which is why I thought it was frozen. I'm not seeing.
How do I support others?
All right, awesome. I'll just go from my slides that I have here. Sorry, everyone. All right. So we think about those around us. So we talked about resilience in ourselves and promoting it in those around us. We might ask ourselves, like with someone who is either recovering from mental health challenges or experiencing just a load of life's adversity, what can we do? One of the most beneficial things I think that we can do is offer an ear, is listen to someone. We don't necessarily have to always go into problem solving, but listening to someone and giving them a space to express what they're feeling and why they're feeling the way that they are. And as the support person, we can work on validating that, right? Validating their feelings, validating that, what they're experiencing right now makes sense. Because oftentimes when someone has not experienced this level of validation of feeling that their thoughts and feelings matter and make sense, they may not trust their own gut feeling about what they feel. So being able to offer to people, hey, this makes sense that you feel that way, can go a long way. and not minimizing what other people may bring up as challenges or adversity in our life, even if we might not find it at that same level of adversity for ourselves. Just working to not minimize and really just acknowledging for them that, we're in this life thing together. For our next slide. And we talk about what we could do, and we look at this diagram here, and it really outlines some of the steps as those who are both experiencing adversity and mental health challenges, and for those who we're supporting throughout them, right? We think about sort of learning, advocating, and teaching and promoting some of these like problem-solving skills, positive thinking, leading with optimism, getting our loved ones and for ourselves in moments where we can participate in some of these different events. So this just sort of outlines some of the steps that we really can take when it comes to helping those bounce back from adversity and challenges. Another important topic is being able to have the awareness to recognize when something may be beyond our control, and really recognizing, hey, this is beyond just general life stress, of just navigating daily life, navigating relationships. When it becomes to get too much, recognizing some of those signs for yourself, when some of the strategies you've tried to implement aren't really working, your support groups are giving you support, but you're still finding life to be challenging. Really recognizing that it may be time to then start to seek out some other levels of supports, whether that be, faith-based or mental health treatment services. And on our last slide here, we just listed a few resources that we find that are going to be pretty helpful for those who might be looking for some of those supportive mental health spaces. So listed here, we have our Safe Black Space, which is an organization that offers some more culturally individualized resources to help people really heal from some of the historical trauma for communities of color. We also have a link here for you being able to find an inclusive therapist for yourself as well. And some other resources along the lines of our Maryland State, who often has a long list of resources from mental health therapists, psychiatry, or just other supportive services. And then we have our free suicide and crisis hotline, which is available through text or call. And if you have some disability services, you also can utilize the TTY services as well.
And that is our last slide.
Awesome. Thank you so much. I'm going to open up the floor for questions. If you're on YouTube or Facebook, you can ask a question in the comments. We have a comment from YouTube that says, I'm a parent. What do I do if I can't get my child to talk to me about how they feel?
Darius, you want to go ahead?
Yeah, I can take the spearhead on this one. I think that can be tough, especially depending on age. One of the things that I'll always talk with my parents who have these sort of concerns, like my kid won't talk to me. I think about like consistency, really letting your kid know that you are here when they are willing to talk about what's happening or what's going on. And then as a parent, if our kid isn't maybe as open with us, thinking about if we can surround them with other supports that they might find a little bit more comfortable at times to really open up. So there's multiple levels. That's when we talk about like involving like our community leaders, other family members, and other support groups that you might have.
Yeah, and another trick that I think works pretty well is that it depends on the age. Definitely teenage kids are a little bit more difficult. People talk about, oh, the terrible twos. The terrible twos are great. You pick them up and you move them. They do whatever you say. A teenager, good luck with that. You will not make them do whatever they don't want to do. So I think it's important to establish a pattern of communication when things are going well. So when they get used to talking to you about the good things. So whenever a bad thing happens or they don't feel well, they will also be able to tell you. So I think establishing the pattern of communication in a routine manner will come a long way when things change.
Yeah. And that could, just to piggyback off of Carmen, that could be us just, you setting a, 10, 15-minute check-in at dinner, just sort of making it that like routine. And sometimes, are under the guise or assumption that parents are only concerned when things go bad, right? So also showing up when things are going well is very important.
Yeah, and I think the other part that yes, parents can and like just as adults in general can do better is to make sure that we show an open mind if there's any kind of communication, to not appear that you're having a judgment of something that they're sharing, to keep it open and willing and able and available and supporting. So I think all of those things kind of affect the way that people approach you. If they think that you're going to be receptive to reach out for help, it will be way easier for them to approach you. Just think about this. There's especially if it's a boy. Why? This is the way we have been, kind of built and designed things in society. Men do not cry. You're a girl. You whatever. You're weak. You don't know. So all of those terms that can describe weakness might interfere in the way somebody will try to access help. That's one. The second one is the stigma in general. How people say, you're crazy, oh, you're insane, you're not. And one of the things that I really try to work very hard is to change our patterns of how we speak, because words matter. Words matter. And it's all funny and jokes until somebody you love needs this care. So I think it's very important that we keep an open door for communication, avoid judgment, and be, kind of willing to be open to a conversation.
And I think modeling is also an effective strategy too. As the parent, sometimes as teenagers, they're not able to really recognize what they're feeling all the time, or they know what they're feeling, but they're not able to express it. We think about as a parent going through life, and you've had your life experiences, and being able to really recognize what you're thinking and what you're feeling, and able to put words to it. I think modeling that for your teenager, and sometimes just sharing some of the challenges that you might experience and how feelings are connected to them, I think really can help a teen see, oh, okay, this is what is acceptable. This is okay. To go a little bit back to what Carmen mentioned.
Yeah. And you know what? One more comment also. I'm sorry, Emily. I think you were going to say.
It's okay.
But the other part that it's really important is when a teenager is talking to you, you need to set up the framework for the conversation you're going to have. If the teenager is going to trust on you, or any kid is going to trust you with something, you have to be clear on who are you going to share this with. You cannot be chatting with aunt here and let me call my mother-in-law and tell her the story, and like now all the whole family knows and there's a drama and Uncle Joe has an opinion, and then it defeats the purpose of the communication. You need to address it with the one person and then decide what are you going to do together, not and avoid the kind of let me chat it to everybody in the world. That is very important, because the moment that they lose the trust in you, you're done.
And sorry, I know can we say last thing? I got one other point I want to make too on this topic, is just thinking about when our teens are sharing things with us, right? Our kids, our children, working as parents to like hold back that urge to just jump into problem solving, right? Sometimes your teen is just going to need an ear, but they may have the assumption that, oh, mom, dad, grandma, whomever is going to try to fix my problem. They're going to show up at school. They're going to embarrass me. They're going to tell me stop hanging out with this person. Sort of along the lines of some of the judgmental things that Carmen mentioned that can just slip out with good intentions as parents, right? Is you hear that your child is having a trouble, it's almost instinct to want to try to help them, solve that right away. But as you're starting to build up that habit of continuous communication, holding off on the problem solving sometimes is a good strategy. Just really validating, hearing them, oh, that makes sense. I hear you. Even simple things as that sucks. I can understand why you feel that way. So just really validating what is being told to you by your teens.
What a thorough response. Thank you so much. And this actually, a lot of what you said actually goes along really well with this next question from a Facebook user. I've finally been seeing a therapist that is unheard of in my family. I'm interested in medication per my therapist's suggestion to see a psychiatrist, but I'm unsure how to even approach this. Can you talk about that a bit?
So I think number one is, get to understand what it means to see a psychiatrist. I think it's really important that you know what to expect. And psychiatrists, we are physicians, we are medical doctors that kind of help people with emotions and behavior, right? So when you meet somebody for this kind of visit, what they are going to do is to have a conversation. They're going to ask you, how can I help you? Because everybody has different expectations. And then they will ask about what kind of things are getting in the way and what kind of difficulties you are trying to address. And they will work with you to find a diagnosis. So sometimes you can have a clear diagnosis and sometimes you do not. It just depends. And then they will present to you options about treatment. Now, one of the things that is really important is that, so as a physician, I do prescribe medications, but I also prescribe therapy. So that is very important. I do evaluations and I prescribe kinds of therapies. And not all therapies are the same. People like Darius, it's evidence-based psychotherapist. So Darius knows how to do X, Y, and Z kinds of therapies. So I know what I'm prescribing. So that is really important. So the psychiatrists that you see, they're going to ask you, what are you working with the therapist on and what kind of approach are they doing? And then together you and the psychiatrist can decide, well, these are the symptoms that I'm seeing. These are the medications that can help. And then you have to have a conversation. You have to ask questions. What's the medicine for? What do I expect for the medication to do? For how long do I have to take it? And what are the side effects? And how are we going to monitoring? And it's very important that that for a lot of mental health difficulties, and I hate to say mental illness because I don't like the word, but there are a lot of them that you will absolutely need medication to get better. However, the therapy and the medication together is what is the most powerful tool that you will have to get better. If you drop one or the other when you need both, you're not going to have the progress that you expect. I would recommend that you check the American Psychiatric Association website. They have a lot of details regarding what does it mean to see a psychiatrist and kind of what kind of questions to ask, and a lot of different pages on different diagnoses and different treatments that are available.
Darius, do you have anything to add?
Yeah, I think Carmen covered it all on that end. Just thinking of, I guess, the one piece that I might add as the therapist is like continuing to have that conversation with the therapist about maybe what they're noticing and what the hope is by having you to meet with that psychiatrist. Because like Carmen mentioned, it's in tandem. And a lot of what is going to be helpful is the changes and strategies, perspectives that you take outside of the therapy room and outside of seeing your psychiatrist as well, because just taking the medication is not going to just absolve everything.
Yeah, and it's no magic, and it's like so I work with Darius, right? So we are a team, and we are a team together with the patient and the family, because we are all together in this. We are there to support the patient, but we're not going to do all of it. Mm-hmm. Everybody has a role, and we all have to do it together.
Yep.
Awesome. Well, thank you so much, both. Those were the questions that we had for this evening. For those of you who are watching, I want to thank you for attending and also let you know that we'll have these resources posted for you on our website, hopefully by the end of the week. I'd love to thank Dr. Carmen and Darius for joining us tonight, and also for Kennedy Krieger for helping us host this really informative and very, very important program. Thank you all so much, and I will conclude the stream now. Thank you all. Have a great night.